Hello and welcome. Welcome to Hebe Medicare Cyprus podcast, where science meets artistry and where doctors become true innovators in aesthetic medicine. In this series, we host some of the most inspiring and accomplished doctors from around the world. Professionals who open up about their journey, their expertise, and their exclusive insights behind their private protocols and professional secrets. Today, we are very honored to welcome Dr. Jacopo Gallotti, a leading plastic surgeon who has joined us all the way from Naples, Italy, and Alessandro Galli, the COO of Xcelens International company in Switzerland. Welcome, guys.
Thank you very much.
Thank you very much.
In this episode, Dr. Gallotti shares his experience and perspective on skin boosters, body fillers, and the groundbreaking innovation products from the renowned Swiss aesthetic company Xcellens. Dr. Gallotti is recognized and respected across Europe, first of all for his unique personality, his vast knowledge, and his visionary approach to modern techniques in aesthetic medicine. He lectures on prestigious stages around the world, trained hundreds of doctors every year, and has published articles and researches that have become a true source of inspiration for the global aesthetic community. Stay with us until the end, as we will reveal some of the secrets behind Dr. Gallotti's protocol and the philosophy that guides the Xcellens company's vision of beauty and timeless results. So, Doctor, I'm very happy to have you here today. Came especially from Naples, Italy. Tell us a little bit about yourself. Who are you beyond the surgeries and the gloves?
Okay. Yes, I'm Dr. Jacopo Gallotti. I am from Napoli, and so in the middle of the Mediterranean. My city is a land of water and fire. So in everything I do, I try to put both, like calmness of the sea and the passion of fire underneath the surface. I was trained in Naples my entire life, although I had many experiences abroad all over Europe as a plastic surgeon and reconstructive. My background is basically classical black background. I studied in high school all the ancient classical languages and history. So my vision in terms of beauty goes back to those times. So it's more into the ancient beauty and loving proportion rather than anything else. My first idea, of course, when you're young, you're very idealistic. When I took plastic surgery actually, was to be a pediatric reconstructive. So my idea was to work with kids, especially with cleft lips or malformations, and then life sliding doors. They brought me into the aesthetic field more than reconstructive, but I try to put into it the same vision that it is important to respect proportions, it is important to give beauty to everyone, but never to lose the focus on the patient, because I deal with patients and not with clients.
Thank you. Thank you. If I may ask you another question that was curious for me, is what first drew you into plastic surgery, and how did that path lead you into non-surgical aesthetic treatments?
As I was telling you before, the fact that I was educated in beauty since I was a kid, high school kid. When you study Plato rather than Aristoteles or Roman culture, everything turns around beauty. And there is actually a Greek word that's always stuck in my mind that is kalokakatia. It means kalos kai agathos. So whatever is beautiful outside must be beautiful also inside. So the idea for me is to bring out the beauty, the inner beauty we all have.
That's so beautiful.
That's amazing.
Yeah, it is. Thank you for that. Alessandro, my dear friend, we've been knowing each other for a while now already. I would like you to share with our community a little bit about the Xcelens company.
The Xcelens company, yes. Xcelens company, first of all, thank you, Emilie, for our invitation. Thank you, Jacopo, also to support us in these days. And Xcelens company was born more than 15 years ago in Switzerland. So it's based in Switzerland and work in aesthetic medicine as well. So our mission is to provide to the customer in all over the world, because Xcellens is a company that we're an international, for international customer, the best product in the market for aesthetic medicine. And we are growing from the beginning, and now we have the opportunity to stay with you to talk about some product, to make the practical, to make the theoric part. So I'm very happy to be here. It's a big pleasure, and that's all, because we are in all a lot of congress. The company is present in all congress in all over the world. The most important congress in Dubai, in Paris, in Monaco. So and we are working also to grow. Our mission is to grow a lot again.
One of the things that I find very comfortable working with you guys is that you have a range of products. It's like a one-stop shop. I can find everything I need in your portfolio. Really, you have fillers, you have skin boosters, you have body fillers, you have skin boosters that based on different options to achieve different results for different indications. It's like everything I need, I can find in your company, which is it makes it very convenient for me as a distributor, and also for my doctors, because if my doctors are using your fillers and they're happy with the results, they will be happy to try also the other products from the same manufacturer because they're happy with the results. So today and tomorrow, we're focusing on two kinds of products. First of all, the body fillers today, and then tomorrow we are focusing on the skin boosters of the company. So let's talk a little bit about those topics, okay? First of all, the body fillers. So I would like to ask you the first question that is always very important to know. Which patients are not suitable candidates for body fillers and why?
Okay, this is probably the best question I ever been asked. So rather than which is the best candidate, how do you learn how to avoid what's going to be already a complication even before starting?
Exactly.
First, my first dismissible patient is patient with no realistic expectation. Okay, so sometimes I can be blunt with the patient, harsh, but it's because I respect them and I don't want them to be disappointed in what they do. So if the expectations are not realistic, you must dismiss this patient. So if a patient, let's say it's a patient that it's overweight and maybe they want to make something onto one area, but that's not the right treatment, this patient must be dismissed. So say that the patient has love handles, but she wants to inject the buttocks, the result is going to be very unpleasant because you have to use large volumes and the outcome would be very unpleasant or anesthetic. You have to be straightforward to the patient and say, listen, we can do something to enhance the contour, but first of all, maybe you should be focused on losing weight, or if there is no need of losing weight, or getting rid of what's too much and then add something. Otherwise, we're gonna have a result that yourself, it will not please yourself. The other patient that it's very complicated to satisfy is the former obese patient or patient who have gone through loss of weight. Because all the soft tissues, meaning skin, subdermal tissues, fascia, and even the muscles, they lose tone. They lose the ability and the features to hold anything that's put underneath. So whatever you do is give again an unpleasant result and a complication, because the filler or whatever you put cannot stay in place and will slide down slowly, and you'll find that eventually the product will be somewhere else instead of what you were thinking you had put it. And it happens the same also with surgical procedure. If you're using buttocks implants, for example, in former obese patients, their muscles, they will not hold it in place, but they will slide down. It's like exactly same thing with the face. So there is no real difference between any soft tissue of our body. If the tissue needs to be regenerated, you cannot improve it with adding volume, but you have to go through a process of regeneration. Okay? So the patient must be aware of the journey she or he has to go through in order to be happy with what he's doing.
So what you're saying actually is that the most common treatment with body fillers will be...
Yeah, the areas which are most requested are buttocks and thighs. Not too much calves. I don't really see that many patients asking for calves, although there is a request. Nowadays, probably because also on the images shown on medias, the request for buttocks improvement, enhancement, and augmentation is growing. And I think it's one of the fastest growing areas of request nowadays, yes.
Can you tell us a little bit about the protocol of injection for our Genial 200?
Yes, sure. The patient usually is a patient that is quite young, so say between 20s and 40s. Okay, it's usually a patient fit with a good or normal body mass index that probably has just a will to improve what is called the trochanteric hollowness. This is what 90% of my patients don't like. The fact that although they have probably a round or a nice shape, but there's still a little bit of hollowness on the side. This is what they like most. So the area to be round in all over the dimensions. I don't give treatments right away in patients with even a low grade of ptosis. Of course, I don't give treatment in patients with body mass index higher than 25 because they're overweight, so they need to lose weight before any kind of enhancement. And I recommend the patient that they have to be very aware of what they're doing. That's important, especially in first days. And one other thing I tell them is to inject gradually, so not to have request of large volumes in the same session, because this can be harmful for them.
Alessandro, tell me, what is the most important thing we need to know about Genial 200?
That is the unique product for the large volume, as I told Jacopo. The Genial 300 was born for this reason, to enhance and to improve the volume of the especially buttock and large areas, because that we can do with a normal filler. So it's a special formula that is created with hyaluronic acid with a specific molecular weight that don't create any problem. So because exactly the first things in our world is that the product is safety and that is that activity, but the safety is the priority. So the product is totally safety, don't create any complaints. You can use, as I told you, in not too much in one treatment, but it's better to split the session and to have a result very good. The trend also now is to not to have a big volume, large volume, but the trend is to have a natural effect.
Like a correction,
exactly.
not a complete
Exactly.
change. And how long do you guys think it will last?
In my opinion, well, as any hyaluronic acid, part of it is it goes into a reabsorption process, but with time it can integrate into tissues and it will never go away. So the results, if you add a little bit time by time, will be very stable, if not permanent.
Is there anything I can do to help my result lasts longer?
Well, one thing is respecting the appointments with doctors. So if a doctor says, maybe we should do a touch-up in 6 or 8 months, even if it's 1 vial per site, that's going to help out, first. And second, if you have a very habits of life which includes also cardio sports, that probably is going to affect the lasting of the results.
You mean it will last less?
Less, yes. The rate of absorption will be higher in terms of time. I wanted to add one thing about Genial and why I am using it so much. The product itself has a great balance between the elasticity, so the characteristic, the features of giving shape and projection, but also as a great feature into integrating itself into the tissues. So although it's giving shape, it's also great because you don't feel it. So with time, it will become like natural tissue,
like
soft tissue.
Yes, part of
exactly.
my body.
This is why I like it, because there are other products, but they're very stiff. So they give maybe better projection for same amount of product, but you will see it. It's like an implant, a very unpleasant implant, if you also consider that the layer of injection is quite superficial. You cannot go deeper than the superficial fascia of the gluteus. Okay, so you don't want to see the product. You want to see an even surface, and also at the touch, it must be
when
soft.
I touch it,
yes,
I want to feel.
And
like
this is why I love this product. Never had any problem of swelling, irritation, inflammation, nothing.
Amazing. So, Let's proceed and talk a little bit about the skin boosters. At first, please tell us what skin boosters are exactly.
Okay, so if I am passionate about buttocks and buttocks contouring, I am like I lead my practice with skin boosters. Why? Because I think that there must be a paradigm shift in modern aesthetic medicine. So facial rejuvenation must be more like facial regeneration. It doesn't have to go through adding volume without sense. It goes through the natural stimulation of volume. And skin boosters, low molecular weight hyaluronic acids, even sometimes adding amino acids or sugars like mannitol, are the perfect weapon to my bow to enhance skin quality first, to give soft tissue tone, but also the fact that the hyaluronic acid in low molecular weight is able to affect the fibroblast, the keratinocyte, to migrate, to produce extracellular matrix, to produce other hyaluronic acid or collagen is great because it doesn't give volume as itself, but it replenishes volumes because it stimulates our own body. So this is what I call, and I love to address a lot with fellow doctors, that it's a concept that I call isovolumetric, meaning that the volume stays the same, but where you need it, not just add it anywhere randomly.
Tell me, doctor, which type of skin boosters are most recommended for delicate areas except the face? I mean, neck, décolleté, maybe hands or other parts of the body. How would you know to choose the correct skin booster to different areas?
Well, of course, it depends on the thickness of the area you want to address, and also the composition. Like, for example, in the neck, I want to use something that is not just going to stimulate hydration, but also to produce extracellular matrix, and maybe somehow also to induce the contraction of the platysma muscle. Now, this is cannot be easily demonstrated, but if hyaluronic acid and low molecular weight hyaluronic acid, but also some other molecules such as choline, they are able to improve tone both to skin and underlying muscles or the SMUS. This is what I want to use. So I give a combination of treatments, whether it will be hyaluronic acid plus amino acids plus choline, and sometimes even collagen stimulators.
Talking about choline, let's talk about the product named molecholine.
Yes.
There are many questions in the field that doctors are asking me about this product, because this product is one product that can treat so many cases.
Exactly.
So, from your point of view, doctor, usually, what exactly will be the first thing I will see after I inject the product of molecholine?
Well, Alessandro, as a chemist, knows a lot more than I do because choline is coming out has come out recently as a skin booster or a tissue stimulator. We all know that choline is a neurotransmitter first, as acetylcholine, but has a lot of features, also as a scavenger, as anti-inflammatory. So what happens is probably throughout all these features, it works in on several layers. I use it a lot to give tone to the jowling area, because combining it with other treatments, it will improve jowling.
Improve the skin, improve
Improve the
contouring.
skin, it's improving the fact that there is a lot of tone, a loss of tone here, both with muscles or the fat reabsorption or the sliding down of the.
So, for example, if I see a patient that has a big loss of volume in the area of the jawline,
I can treat that with
Moleculin
moleculin.
is,
Yes, that's great, because it's going to improve the tone of the this mass of the superficial musculoaponeurotic area. It can be also used in lines, in fine lines, but this field has to be investigated further.
now I'm even more curious. Alessandro, you're a chemist. Tell me more about the indications of moleculin.
The indication is the same indication that Dr. Gallotti explained, but the formula is a special formula because it's combined the choline that is an active ingredient that is used to improve the tone, but also contains other active ingredients as amino acid, hyaluronic acid fragment. Hyaluronic acid fragment is very important to stimulate the fibroblast to produce elastin and collagen. And also the amino acid, is the base of the derma, so improve also the fibroblast. So the product is a complete product that contain all. The immediate result is to improve the skin, but the product works also during the time after injection.
Can I use it also on the body, on different body areas?
We can use also in the body, of course.
For what indication?
For
muscle toning.
Yes,
Yeah.
yes, of
and
course.
soft tissue toning.
So this is a perfect moleculin is perfect if you combine with the other beauty vitalizing that work, for example, Xevo or Genial Lift. The combination of these is a program that we study that we will obtain a good result for the patient.
So let's jump to another product named Dublix, the Dublix Evo. Dublix Evo is the best seller of the Xcellens portfolio in my business, and also one of the best sellers in my company. Tell me about this product. It's amazing. It's all the doctors are in love with it.
Because this is it's very simple product. It's more easy than moleculin, but the kilodalton and the molecular weight of hyaluronic acid is 20 mg/ml. So in total, the syringe is 2 ml. And but the origin of hyaluronic acid, the purity of hyaluronic acid, and also the molecular weight stimulate very, very, very well the improve of the fibroblasts. So you have a good result. Good result. For this reason, the doctors love to use the Dublix Evo.
And
yes,
and
of
it's
course.
very versatile. So you can use it whether on the face, on the neck, on the hand, and I even use it for the tear trough because it doesn't give swelling, but improves the quality of the skin, vascularity. And so although you're not adding volume, so you're not feeling the tear trough will improve because of the fact that the hyaluronic acid is stimulating regenerative process by itself.
Exactly.
Amazing. So you recommend to use it under the eyes area.
Very, very, very low, of course, because the low molecular weight will still attract some water. But yeah, in any case, yes, I would recommend maybe 0.2 ml/ml per each side, several sessions, and the tear trough and also the darkening of the eyes will improve. Definitely.
Interesting. How many sessions?
Well, it depends on the patient, but usually between 2 and 3 sessions, separated by 3 or 4 weeks each.
Yeah, and also
the thing is, you are using so little product that you can spread the other in other areas.
Yeah, of course, because
so
the
it's a
syringe
plus.
is 2 ml,
It's a plus.
so you can
treat the
face.
Yeah, you can
play with it.
You can treat
and
the
focus
face.
on the areas where you see.
Yeah, exactly.
They
You
need
can
more.
once you can treat the face and then add a little bit here. When you can treat the neck, another little bit here. See,
And always 3 sessions.
yeah, it depends.
Every
Of
2
course,
weeks?
In young, 3 weeks, 3-4 weeks. Yeah, I give, my patient time to get also accustomed. Having a cannula underneath your eyes is not really a pleasure. So they need also to get accustomed to that. They must be
Genialift.
Oh, that's my favorite product.
Let's talk about Genialift. Based with glycerol?
Yeah.
Tell me about this genius product.
You? Me? Well, the glycerol works as an amplifier of the action of hyaluronic acid. Well, as itself, it's an osmotic molecule, so
Exactly.
it recalls water and helps in hydration, right? First. But many studies using even other alcohol, sugar, such as glycerol, they demonstrate that they work as anti-inflammatory
Exactly.
drug, and also they prevent our body to attack immediately hyaluronic acid. So hyaluronic acid stays longer, and its action is enhanced by glycerol.
I can tell you that I have injected many kind of products in my life, and never in my life I felt so much hydration when I woke up the morning after the injections of Genial, even though it's only 1 ml in the syringe.
I do use too.
Amazing.
Exactly. Because you have the action of, as I told Dr. Gallotti, you have the action of hyaluronic acid, but improve with the add of glycerol that also make a block of the hyaluronic acid.
And all the
So you have an enhance of the effect.
all of the radicals,
Exactly.
inner radicals that will attack hyaluronic acid. So it's a wonderful product.
What else except of hydration I will feel? Like, will it give me a nice stretching or lifting, or what else?
Its name tells it all. Nomen omen, the Latin used to say, in its name there is everything. So the fact that, of course, I always tell my patient, in aesthetic medicine, there is no technique to elevate the tissues, and bring back in position when everything is sliding down. But in terms of give tone and tighten, the Genial Lift is perfect because it will tighten and give tone to soft tissues.
Incredible. I love this product.
Yeah.
So, doctor, how do you see the field evolving in the next 5 years, and what important message you can send to young doctors who are entering to the field of aesthetic medicine?
I'll be quite straightforward. First, I think it's clear nowadays that the aesthetic field, especially the aesthetic medical field, should evolve into a real medicine. So we need to understand that we are dealing with patient. The patient must be treated as they are, and that they need more than just beautification, something that is gonna feel them welcomed in any aspect. And the medicine must turn into a regenerative regenerative process rather than just trying to make everyone look nicer or better. Why? Because with time I realized that, especially as we age, the fact that we look at ourselves and we look the improving it makes us feel better because we feel like time is slowing down. And you know, the ability to give patients this feeling that they can slow down time and give them more time to enjoy life. This is really what my mission should be. Second, to all fellows, young doctors, old doctors, I always, in any of my presentation and lecture I give, there is one suggestion: do not homologate. Homologation is the death of anything. You don't want your patient to look like any other. You want your patient to be special for you and for themselves.
Thank you for that, for those important tips to my young doctors entering the field. Alessandro, my dear, tell me, what's the next step? What is the next destination of the Xcelens company? What should we expect to see in the near future?
We are, as you know, the regulation of a medical device changes. So create a new product is not easy like before, but we just are working to create a new line of product as a medical device class 3, so for injection, and we hope to launch in the next year, 2026.
Wow.
Yeah. We are just making goals, so you know, the bureaucracy is not easy and it's too long. So maybe in the next podcast we will present the new product.
I will be honored.
Yeah, and hopefully there will be me into it.
Of course.
We don't know.
We can announce it here in this room.
Yeah. Yes, of course.
Now I like my question even more.
Yeah.
Good. Okay, good to hear. Can you give us like a slide of direction?
The direction is to create some stimulator product.
Yeah.
Okay, because the trend of the market we saw that is more than a stimulator product. So biostimulator is the trend, but with of course with different like our line that we have. So
Something to complete.
something to something to complete. Just this T product you can use in synergy to have an amazing result. But our mission is to improve also with another product to have other product to have a big result. But as I told you, is a project that will be ready in the next year.
We are all waiting for it.
Thank you so much.
Thank you so much, my friends, for
Thank you for
coming,
having
Thank
me
you.
here.
for being here. Very excited.
Thank you too. It's our pleasure.
And thank you for sharing with us your philosophy, your expertise, and all the secrets behind the products. And I'm sure that the doctors that will watch this podcast will gain a lot of benefit from what they've just learned. Thank you.
Thanks to you.
Nice to meet you.
Thank you.